want to talk to you a little bit about rotator cuff injuries and the surgery that goes along with that. So the rotator cuff is a series of 4 muscles that attach to the proximal humerus, or the top of the arm bone here. And those muscles basically form tendons that sort of blend together, and that tendon blending is called the rotator cuff. And those muscles help rotate the arm as well as position the hand in space, help lift the arm, those sorts of things. And rotator cuff tears are a very common diagnosis, especially in the elderly population, and they can actually be asymptomatic. So it can be one of those phenomena that as you get older, that tendon sort of wears out. In the younger population or the active population, a rotator cuff tear can be very painful and can be sustained more in a traumatic fashion, in which case that's not a normal part of aging. And those are the ones where we really recommend repairing it, because there's been good studies to show you have better outcomes if you repair that tendon back down to the bone than to just let it retract. So what I mean by that is that when the tendon attaches here, the muscles pull that tendon back away from the bone. And so that's not the normal anatomy. If you've sustained a rotator cuff injury, usually with lifting something or trying to catch a heavy falling object, oftentimes we can diagnose that with an MRI and or physical exam. And once the diagnosis has been made, we often try to get your motion as good as we can prior to the operation. Then the operation is performed under general anesthesia, also often using a nerve block to help put the shoulder to sleep. And then with you asleep, I'll put 5 or 6 small holes in the skin called portals and introduce the arthroscopic equipment as well as instruments. And primarily we'll look at the whole shoulder joint, so we can evaluate the cartilage, the joint itself, any of the other ligaments or and bones there. And then basically address that rotator cuff. The way to do that is, again, using those small instruments, is to place suture anchors in the bone, and then that suture goes through the torn tendon, and we tying knots basically sew that tendon back down to the bone. Once that's been done, we have to wait and let that tendon actually heal to the bone, the goal being that that cuff repairs itself down to the bone. After the surgery, obviously, we close up the incisions, usually put an ice pack and then in a sling for about 6 weeks. Back to full activities does take 4 to 6 months after a rotator cuff repair.